Welcome to today's Rate Fast Speed seminar. Today we're going to be discussing spine specialty consultation in the context of workers' compensation. My name's Dr. John Alchemy. So let's start off by discussing and defining what is a spine specialist. A spine specialist may actually be an orthopedist with a fellowship in spine training, or it may be a neurosurgeon. The goal of referring to a spine specialist is to determine if surgical intervention is indicated. The specialist may also expand on the diagnosis and make further recommendations for diagnostic testing or further treatment options. In California, we use the ACOM 2nd edition guidelines, and they are very generous and liberal in the indications for referrals. So the reason for this is that when the patients are not getting better, there's a low threshold to get additional help for the primary treater and the patient to expedite diagnosis and treatment. So in summary, the goal for referring to a spine specialist is multiple. The first is to confirm that the diagnosis is correct. The second is to confirm that all appropriate tests have been performed. And the third is to determine if surgical intervention or conservative care is immediately needed for ongoing management of the claim. Now a little nerd knowledge. What is the spine specialist specifically doing and looking for at these evaluations? The first is a careful history. How is the spine injured? What are the current symptoms? Where do they travel? What side? What's the quality of the symptoms? What makes the symptoms better? What makes the symptoms worse? Next, a systematic objective evaluation, an inspection of the spine, a palpation of the bony landmarks and soft tissue and nerve roots. Documentation of the range of motion in all the basic planes. And finally, a careful neuromuscular exam to determine nerve root function, sensory strength, and reflexes. Once this information is all collected, the objective diagnostic testing can then be reviewed, looking for soft tissue lesions such as herniated discs or bulging discs, narrowing of the nerve outlet through the spinal canal, levels of arthritis, and also slippage of the bones on one another in the spinal column. The spine specialist will then take all of this information and make a determination if there is a surgical procedure that would help the individual. Now, the interventional procedure could range from a spinal injection all the way to invasive open surgery. And here's where the spine expert's experience comes into play in making that determination if, based on their medical experience and knowledge in the field, a procedure would actually improve the patient's symptoms and functions. Now let's do some problem solving. A 34-year-old female comes in with a chronic low back injury. She has been worked up with X-ray and MRI, none of which show any significant problems. She has been treated conservatively with physical therapy, anti-inflammatories, and modified work, none of which resulted in improvement. She continues to complain of pain in the right lower leg above the knee. Question: is spine consultation with a spine specialist recommended or indicated? Answer is yes. Why? The employee is still having disabling pain and discomfort and is not improving with conservative measures. Referral is indicated for a second opinion to confirm the diagnosis and see if any additional testing is indicated, perhaps nerve conduction studies. The specialist could also consult on an opinion if injection therapy is indicated or if a decompression spine surgery is indicated, despite the findings on objective documentation. Remember, guidelines used in California do support the use of referrals and specialists when helping the primary treating physician treat workers' compensation injuries. That's it for today's speed seminar. on spine specialty, referrals, and consultation. To learn more, please visit our website, rate-fast.com, and click on the blog to learn more about spine specialty referrals and other interesting topics associated with workers' compensation and impairment rating in California workers' comp.